which lead to sleep issues. And I am extremely passionate about babies. I breastfed. I'm still breastfeeding my youngest one. So I'm a huge breastfeeding advocate and very well trained in tongue ties. With that being said, I do not treat babies. I start my patients usually at 4 or 5 years old, but since I'm educated, I feel comfortable talking about it. It's not very simple as just going and getting a tongue tie release. The release itself is not going to fix anything. You have to make sure you're looking at everything from an interdisciplinary approach. So just going to an ENT or a pediatric dentist and getting the release done a lot of times is not going to give the mom all the benefit that they need for the breastfeeding relationship to work. So working with an IBCLC, which is an international board certified lactation consultant, somebody that is well versed in ties. And I usually tell all my patients or my patients who are pregnant, go ahead and call around, have an interview with a IBCLC, learn, take a breastfeeding class, try to get as much information as you can before you have that baby. Because we all know that after you're in the hospital or at home, whenever you're having your child, things change and you're not really thinking, and there's hormones and there's just so much happening. And whenever you bring the baby on and you're having pain, you're just not thinking straight. So if you have this information before you even get there, it's a lot more helpful, and hopefully your breastfeeding relationship will last longer.
Absolutely. One thing I wanted to say is I did learn something new from watching your program. And one of those things was that the massage, I thought it was excellent. And I even went and looked at the website, and then I called a few people, and it was like, y'all need to go do this, go to the massages, do the baby, because I've learned that you were saying something about the massages help, but what does that do?
So there's several therapies that the baby might need whenever you have a baby that is super tight, has torticollis. Some professionals, like a physical therapist or an occupational therapist, they perform something called craniosacral therapy, which is kind of like a chiropractic adjustment, but it doesn't look like they're doing anything. They're literally just barely holding the baby, but they are feeling things around and loosening them up. That's very important to do while in the process of getting a tongue tie release. And then there's some intraoral massages that some professionals who are trained in oral motor work, they can go inside the mouth intraorally and do some massages for these muscles, because these muscles are all tight, and you can kind of tell which babies will just clamp down and will be hurt the mom that way. You can touch and feel if your professional allows you to do that. But those really help the baby kind of relax and release. There's a professional in South Carolina. I've been to his office while he's doing releases, Dr. Rao. He's amazing. And he has a craniosacral therapist in his office. So she works with the baby. It's amazing. They turn the lights down, and she works with the baby for about 15 minutes before they even do the release. And it's insane. The baby literally just melts in her hand.
Wow.
And they're so much calmer, and the release is extremely fast and goes straight to the mom's breast right afterwards to breastfeed. But it's so important to keep going with therapy sessions. So either craniosacral or a chiropractor, depending on what that baby needs. Everybody's different. You need to do that after the release is done. You have to do stretches, which depending if with babies, yes, you don't get stitches. So you do have to do stretches after the tongue tie release, because otherwise it will reattach. Reattach is healing. Another thing is that you have to make sure it's done properly. How many people do you hear saying that they had a tongue tie release or a lip tie release and they didn't notice a difference?
Right.
A lot of times the professional is not well trained. These things are not very well taught in dental school or medical school. So these are courses that they have to take after they have gotten out from school to be able to really learn how to properly do a release or a functional release.
Wow, that is amazing. I mean, like why do they have to clip Like, that's what I really want to know, because I'm hearing so many different things about that. Like, I'm hearing you don't really have to do it, or you do, you just need to do massages, or like, what is the...
Oh, myofascial release.
Yeah, myofascial release.
So myofascial release, it's a little bit different. They say that they can stretch a frenum and they can release fascia. So fascia, if you think about a piece of steak or meat, have you ever thought about that, the little white thing that covers kind of the whole meat? That's fascia. It covers all of our muscles. And some people say that by doing certain massages or myofascial release, they can stretch fascia. I have heard reports that is not accurate. The frenum is made of connective tissue, so no, you cannot stretch a frenum. If a baby is born with oral dysfunction, you can put that baby whatever position you would like, and maybe you will find a position that's okay for that baby to successfully breastfeed, but you're not fixing the oral dysfunction. You still have to address that. It's very important.
Wow, that's amazing. Like I never even knew that, like there was even somebody out here that's doing this stuff. You know what I mean? Because what we're told is to, go see an ENT or a dentist or...
Yes, tongue ties can impact so much more. You can have speech issues. You can have feeding issues.
That's what I wanted to ask you.
Sorry.
No, it's okay. It's okay. You walked right into it. But that's what I wanted to ask. How can you have neurological issues?
So it's kind of like a snowball effect. If you have a tongue tie, you're more prone to mouth breathe. If you mouth breathe, it's shown that it's about 18% less oxygen that goes into your brain. If you do that through your whole life, there are studies that show that those people have lower IQs. So maybe in that sense, yes, you can have some neurological issues from having a tongue tie, but it's not necessarily just the tongue tie, it's everything else that the tongue tie is impacting. Feeding is very important to look at. Usually a baby cannot lateralize the tongue, going from side to side to properly be able to chew and accept certain textures and be able to swallow properly. So those are babies that will not eat meat. And I've had patients say, oh no, my child just decided to be a vegetarian at 4 years old. Really? They just don't want to because maybe one time they choked, and now they would just avoid it. They didn't want to be around it. So it is a difficult decision just having a baby and deciding to go through something like a tongue tie release. But it's about 15 seconds, 5 to 15 seconds of a laser procedure, and then the baby's put on the mom's breast right away. Whenever you talk about circumcision, that is so much more well accepted. About 75% of baby boys in the United States are circumcised, and it's about 15 minutes of a baby screaming and crying.
Wow.
For no apparent functional, resolve right there. So we kind of have to change how we are looking at these things because it can affect your life in other ways. So being more educated, that's why I'm so passionate about Airway Circle, being more educated and bringing this to other professionals and other parents. If you know this information before you go into it, you're more likely to make an informed decision.
Wow, that's a lot of information.
It is.
Well, this is great. Where are you? I know you're located
in Savannah.
In Savannah. So do you have a practice in Savannah?
I do. So I'm a myofunctional therapist in Savannah. Most of my patients, I see them online. And then the rest of my time, I do Airway Circle.
So you have like an online type, like different methods and techniques that you kind of do with your families?
Yeah, so I'm getting these babies that were not released. I'm getting these kids that still have oral dysfunction at 4 or 5 years old.
Wow.
So these are kids, a lot of thumb sucking, tongue thrust, feeding issues. They don't like certain textures. They're hyper during the day because they're not sleeping or breathing well. There's so many issues that myofunctional therapy can help with. But we're pretty much working on nasal breathing.
That's what I was going to
Tongue position. So your tongue has to be suctioned to the roof of your mouth day and night. just like that. Lip seal, your lips should supposed to be closed always, so you can breathe in through your nose. And then we look at functional chewing and swallowing to make sure that those things are working properly.
Oh, and how long is the sessions for? What does that look like?
As you can tell, I talk a lot. So my sessions usually go to an hour. It's usually 30, 45 minutes, but I talk to my patients about everything. They become my friends. I want to know how their family's doing. So we end up going a little bit longer, but usually sessions take about 30 minutes. I can keep my patients from 4 months to a year. It depends on what the issues are. I see adults also. Most of these adults have more of sleep issues, sleep apnea, UARS. We can help with all of that.